This is Selma Schimmel for the Group Room at the annual San Antonio Breast Cancer Symposium. Joined now by Dr. Joe Mortimer. Dr. Mortimer's Vice Chair, Medical Oncology and Therapeutics Research, and the Director of the Women's Cancer Program at the City of Hope in Duarte, California. Thank you for coming back year after year. I want to talk to you about your research.
What we're working on and what we presented here is a sort of an assessment of HER2 in women with metastatic breast cancer. So this is a really important topic in general. I mean, HER2 is a target with now many, many new and exciting agents. But being able to identify the patients who are most likely to benefit from them is really critical. And we've changed how we measure HER2 in many different ways. You know, the first metastatic disease trial called HER2-positive anyone who by immunohistochemistry was 2+ or 3+. And then we kind of took off at FISH gene amplified was positive and 3+ was positive. So what we are using is a PET imaging agent that we developed at City of Hope. It's essentially copper-64 on Herceptin, and we've used it to image women who have metastatic breast cancer. And one of the things that we did in this study was try to improve what the images looked like. Because Herceptin is a humanized antibody, it's very hard to study Herceptin and trastuzumab in an animal model because the antibody doesn't have any impact on an animal. So even if you put human tumors in an animal, it only goes to the human tumor. So one of the problems with PET imaging of Herceptin is that there is normal tissues have HER2 in them. So what we did in this study was to give women small doses of trastuzumab of Herceptin before we injected the radio label to do the PET imaging. And it turned out that a small dose of trastuzumab before injecting the radioisotope resulted in improved ability to find the cancer. So once we established that we could do these images and that we could see cancer, and many times we saw cancers that we didn't see on glucose PET, but we did see it on the copper PET, then we moved on to the second part of our study, which was to look at women who have HER2-negative breast cancer. HER2-negative breast cancer by immunostaining. So women who are IHC 1+ and 2+. And the fascinating thing that we found is that many women take up this tracer, take up this Herceptin with copper on it. So where we hope to go with this is that what we've done is to put copper onto Herceptin. This new drug, TDM1, which hopefully we approved soon, is a killing agent, maytansine, on top of Herceptin. So if we can image a patient's cancer with our copper-64 PET, that would presumably predict for benefit from TDM1.
How did you know that you could isolate or highlight on imaging using Herceptin as your tag? How did you know that?
So we first, and I had nothing to do with this, but our basic science folks at City of Hope, almost 20 years ago actually, developed this imaging agent in animal models. So they would put a human breast cancer onto an animal and then use this imaging agent, and it would light up very directly. But again, because animals, even if they have HER2, it wouldn't confound the humanized antibody. They were beautiful images, and when it went into humans, it turned out the images were not so good, because in addition to imaging cancer, you're imaging normal HER2 in the body. So that's when we came upon this idea to pre-administer some cold Herceptin before to improve the image quality.
Thank you. I was just curious. I always find that what you all come up with in the lab, it's extraordinary.
It is extraordinary. And tomorrow there's a paper talking about, again, how to identify people with HER2. So there are mutations of HER2 that may actually confer HER2-positive biology, but which by measurement would be HER2-negative. And I think, again, because these anti-HER drugs are so incredibly effective, it's unfortunate if we're missing women who are really potentially likely to benefit from these drugs because of the way we measure it.
If a woman recurs with breast cancer, and they were, let's say, HER2 negative first time around, with a recurrence, would you retest?
Yes, and that's of course a brilliant question, Selma, because cancers really do change. Now, whether they change because you kill out the population of cells that were sensitive to chemo and now the HER2s grow, but it turns out that between when a woman is initially diagnosed and when they develop recurrence of a breast cancer, that about 20 to 30% of the time it's different. So in the initial 10 patients that we first screened, all of whom had HER2-positive disease at diagnosis, only 8 of them actually had HER2-positive disease when the cancer recurred. Another potential use of this agent is that you wouldn't need to biopsy women. If you could just do a HER2 scan, you could show that the cancer was HER2-positive.
And in initial testing, are there ever mistakes? What's the ratio of false readings?
There hasn't been a recent assessment of concordance from lab to lab, but in the initial studies that were done for the adjuvant trials, the discordance rate between my measuring it and you measuring it at your institution and central lab is somewhere between 15 and 20%. So it's meaningful that some people are being said to have positive cancers and getting Herceptin and its potential costs and potential toxicities, and some of those women are not getting it and could potentially derive benefit. So an accurate assessment of HER2 is really needed.
The stage that you are in your research, where does it go from here? How far are you evolved?
So we're still finishing our imaging of women who are 1+ and 2+ positive to show that their cancer does pick up the radio label, and then hopefully we're going to go to looking at TDM1 in women who are HER2 negative by measurement, but who by our PET imaging are actually picking up the tracer.
Dr. Joanne Mortimer, Vice Chair, Medical Oncology and Therapeutics Research, Director of the Women's Cancer Program, City of Hope, Duarte, California.
Thank you, Selma.
Thank you, Dr. Mortimer.